Hello, hello, everybody. Hello, hello. I hope y'all can hear me. I am. Oh gosh, it's a fly in here. Um, Wait till everybody hop on. Hold on. All right, all right. Hey, we've been busy today, y'all. I know it. Rochelle, uh, you have been in. It's been back to back lives. I think I've seen you in three of them or two of them. So y'all come on up in here. Come on in here. Oh wow. Y'all, it's been a long one. It's been a long one. Hold on. I'm tired. Y'all, when I say I'm tired, I am tired today. But I said, let me get out here real quick and talk to everybody and tell them about um wave two. Let's talk about that. Yeah, Rochelle, you good evening. 12 people in here. Man, when I say Sister E is tired right now, y'all, we had, let's see, let me do a countdown. So um we had Dante. I was in the chat. Oh God, that chat and Dante live was interesting. Then I was on Bereans has a Patreon thing he did today. Hey, Pastor Johnson. Um, then I did some with Tayu today. Y'all, when I tell y'all I'm tired, but I wanted to say hello to everyone. And I want to kind of talk about wave two. Yeah, wave two is coming. Wave two is definitely coming. Um, I saw a news report about wave two. I kind of wanted to show everybody.
If you buy camera gear on Amazon.
Oh, they got the queue. I got to queue it up. But yeah, wave two is coming. Wave two is definitely coming. Grace and peace, grace and peace. Yeah, it is here. Actually, wave one has not left. That's the crazy part. It's kind of like wave one was kind of quiet so we can get out. And then when they got out, wave one said, hey, we ain't going nowhere, so we're going to make it worse. So I ran across something, and I'm going to play it for everybody, and then we could talk about it. Let's see. It hadn't went anywhere. Let me find the video. Hey, everybody. Hey. It's been a busy day, y'all. Then I was listening. Let me not forget, I was listening to some of Pastor Johnson's lives as well. Pastor Johnson has been doing a bill session with Surreal. And I commend him doing that because he's doing a good job. You know, it takes the wisdom of our elders to show us, how to conduct ourselves. Yacoba they did something today and it was very good. Dante did something, and some of the UA community was in the chat acting crazy. It's just been a crazy day. Crazy day. So I was gonna not do one, and then I said, let me do something real quick. I ain't gonna keep y'all long because I know we've been busy today. And yesterday, because you had yesterday. Check out my community tab, and I'm gonna add yours as well, Pastor Johnson, to my community tab. And what I do is I spotlight different shows that are, that I've seen and that are good. And I put it on my page. Pastor Kelly did something today as well. So everybody's been busy. And Sister E been like, I'm gonna find me a spot to fit in where I can get in tonight. And then I was like, no, I'm not gonna do nothing. I'm gonna kind of chill at home. And then I said, you know what? Let me just talk about this COVID, and it's gonna be quick because it's interesting to see that the numbers are going to increase. And if you're somewhat of someone who's well read in history, when you look at epidemics or pandemics, let's say what flu was that? The Spanish flu. The Spanish flu came in, I think they said 3 waves or 4 waves, but the way it came in, they want to say it was 7 waves. The first wave of Spanish flu wasn't that bad. The second wave was the wave that kind of took them out. It was really bad. Let me see if I find some on Spanish flu as well. But I said the second wave was really bad with Spanish flu. That's when the numbers were. That's what we hear about in history was the second wave. It wasn't the first wave we hear about in history. It was the second wave, which was the huge numbers when it comes to the waves with the Spanish flu. Let me see. Let me see if I can find some. Let's see. Hold on. Oh, here it is. This is the one. Hold on. I'm going to show y'all 2 videos. And it talks about the similarities of the Spanish flu and how COVID could potentially be like the Spanish flu as far as the waves. So, and I hope I'm saying it where y'all can understand. Y'all can understand me. I'm a little tired, but I do want to show this. Let me see. I'll start with this one. Now this is the video again where they're talking. Yep, the Spanish flu of 1920. This video talks about the Spanish flu and the wave 2, lessons from the wave 2 of 1918 flu pandemic. Was it Spanish? Yeah. Let me share. All right. Let's see. Here we go, y'all. Play it now.
This debate over when to reopen, pitting economic concerns against public health.
There's 50 states with 50 plans, many of them allowing more activity, more interaction.
When and how to reopen parts of the economy have become highly charged political issues.
As coronavirus lockdowns begin to be loosened across the country, and people begin returning to restaurants, offices, and outdoor spaces, memories of the past are starting to echo in the present. It's not the first time the U.S. has grappled with the question of when to reopen after a deadly health scare. The flu pandemic of 1918 infected 1/3 of the world's population. Though several deadly flu outbreaks have followed, it remains the deadliest on record, killing an estimated 50 million worldwide, and over 500,000 in the U.S., according to the CDC, all of which played against the backdrop of World War I.
The pandemic started in military camps, first and foremost. So the military worked to try and control those epidemics in the camps. And these camps, a lot of them were located right next to the American cities.
Dr. J. Alexander Navarro of the University of Michigan Center for History of Medicine was part of a team of researchers that asked a key question about the 1918 flu pandemic. Did implementing non-pharmaceutical interventions like social distancing, school closures, bans on public gatherings prove effective in saving lives while developing a vaccine?
We studied 43 American cities. They were the largest American cities at the time. And what we found is, based on our historical data and the statistical analysis, is that cities that implemented these NPI, these non-pharmaceutical interventions, early in a layered fashion, so we're talking about layering multiple interventions, and in a sustained manner, so kept them on for longer, those cities fared better.
Statewide closure orders, mandatory mask ordinances, and other forms of mitigation were widespread. Cities like San Francisco even imposed fines on individuals failing to wear a mask in public. Though one of the main differences between 1918 and 2020 is the importance of the service industry for the modern economy.
Economic life was a lot different than today. The ways in which the disease is spread, those are going to impact and have impacted the service sector jobs more than anything. We had, this is an economy that is built on the service sector. So I think we're in for a much greater and more severe economic impact today than we were in 1918.
The fall of 1918 was the deadliest period in the pandemic in the U.S., right as soldiers were returning home and supporting the war effort was at an all-time high.
The historical context here is daily life was heavily impacted by the war effort. And so the average Joe in the fall of 1918 was very much preoccupied with things like the Liberty Loan drives. So the idea was to get as many subscriptions. Each city had a quota of money they needed to raise.
Philadelphia's decision not to cancel its Liberty Loan Parade in late September resulted in 1,000 deaths in the span of 10 days. Other cities like Denver lifted restrictions that November on Armistice Day to celebrate the end of the war, only to experience a deadlier spike.
Thousands of people flock to downtown. They go to movie houses and theaters and auditoriums to hear lectures about the end of the war. And almost instantly, within a few days, there's another huge spike of cases, and then shortly thereafter, deaths. And that second spike is actually deadlier in Denver and a few other cities than the first spike of cases.
The advances in medicine, science, and technology have made the 2020 landscape vastly different. But the same behaviors might still ultimately persist, even with guidelines from the CDC.
Even though the historical context changes, there's going to be a great clamoring to get back to life as normal. And although epidemiologically the virus and the pandemic are going to be with us for some time, that's not the only definition, unfortunately, of a pandemic. That's the scientific one. But if society determines there's no more epidemic, despite the fact that people still might be dying, if they feel that there's just the risk is worth it, people are going to go back to life as normal. And there could be really terrible public health consequences as a result.
So if you notice, it talks about how it was kind of like similar to now, a mad rush to get back to a level of normalcy that people are rushing to get back to work, trying to get back to living a normal life. The biggest fear for some people is change being that, loss of job. I know here recently, one of the biggest companies I don't want to say biggest, but yeah, biggest. One of the most well-known companies in the world had a layoff this week. They laid off 22% of their workforce. It hit kind of close because I used to work for this company. And I actually worked in the department that got hit the hardest. And I left the company, 4 or 5 years ago. But Hilton laid off 22% of their workforce, the corporate side. Because if you know anything about Hilton is a franchise. So they really can't do anything as far as the actual hotel facilities themselves. It depends upon the franchise owner and how well they're doing, that, if they're going to have layoffs or not. But as far as corporate is still owned by the brand Hilton. Hilton laid off 22% of their workforce. And I was on LinkedIn and I saw all the messages of, y'all, I've been laid off. And it's like, wow. Then there's a major, if you've heard anything about ALSAC or St. Jude. St. Jude that's another company that just did a layoff this week. And what's interesting is, if you know anything about St. Jude, it helps, the hospital itself was created by Danny Thomas, and the hospital helps any children with terminally or extremely deadly diseases, and they do it for free. Well, they have a division within their company called ALSAC. And the thing is about St. Jude is heavily dependent upon charities, because that's how, they keep the bills paid. So they have a lot of charity events. So they have a department called ALSAC. ALSAC handles all of the coordination of their events. Well, ALSAC had layoffs. I said, wow. But you got to think about it. In this climate, you really don't have an opportunity to do a lot of charitable events, because when you look at it, they did stuff like marathons, walkathons, and a lot of things had to do with crowds. So they had layoffs. So, and it's a couple of companies, and I'm just speaking from my side, that I've seen that have had major layoffs, but I have never seen LinkedIn. And if you know anything about LinkedIn is what you would consider to be Facebook for professionals. And that's where you hear about all jobs and stuff and things that's going on in the market. And I kind of watch LinkedIn to kind of get a pulse of what's going on. Plus, you do it to meet with recruiters. That's how you get contact with recruiters. I've got more jobs being on LinkedIn, or job, calls about jobs on LinkedIn. So I was looking on LinkedIn today, yesterday, Friday and Thursday, all this week pretty much. And that's all I saw was I've been laid off. I've been laid off. I love my company. I've been laid off. And I'm like, wow, I've never seen LinkedIn look like this. I said, yeah, something's going on. I know something's going on. But when it spills over into that environment, because again, you got to be very careful in what you say on LinkedIn, because recruiters look out there. That's how they find, candidates. Especially now, it's so many resumes that's going out to these companies because so many people are being laid off. That I don't think HR has the bandwidth to go into their database to see who's applied sometimes, because it's so many. Like, they'll post a job on LinkedIn within, I want to say, an hour. I've seen cases within an hour. It tells you if you apply for a job within their tool. They have a tool within LinkedIn where you can hit, easy apply, and you can, upload your resume to the company. But it also gives you a head count of how many people have applied. So what I do is mainly, and I've just started doing this, is applying for jobs that say that I am considered to be top 10% of all the people that have applied. As far as my skill set, I'm the top 10 that they would, if I would apply, they would see my resume. But as soon as it can be an hour, 200 people applied. Once it hits 200, it always says more than 200 people have applied. I pass those fast. So, but LinkedIn now is so heavy right now with people applying that even people on LinkedIn complaining, saying, I applied for this job, got declined, and y'all repost this position. I thought this position was over with. LinkedIn can't even handle, I don't think they can handle the traffic of people applying for jobs. And it's obvious. It's real obvious. Something is going on as far as the market. Excuse me, my allergies have started back. I'm getting better, y'all, with my allergies on. But it's just so heavily saturated as far as the workforce, the lack of work, that is obvious. I mean, I have never seen LinkedIn quite look like this. I'm trying to find another article I ran across, but yeah, LinkedIn they cannot handle it. So let me see. Talk about Hilton. I want to show y'all, because Hilton is like, I mean, this is their time of the year. This is when they make their money. Marriott has already done layoffs as well. Marriott forced to furlough thousands of employees. So you see, but the thing is, those are a lot of the service industries, the hotel industry. They depend upon tourism. When tourism dries up, it impacts them. I remember about a couple of weeks ago, about a month ago, I got a hotel room because I was working, trying to get ready for an interview, and my house is loud. So I said, I'm gonna just get a hotel room. One of the hotel rooms in Memphis that normally has that cost $200 a night to stay in, it's normally, $200 a night. I found a hotel for $80. I hopped on that so quick. I said, oh yes, I'm gonna use that one. But I mean, that's the time we live in now. That's the time we live in. So we have to learn how to, put our money aside, tighten our belts. We don't have a problem about that. That's life for us. But let me see. I saw something else. Here it is. Let me see. Cue this up because I know. Oh, here we go. And I'll go back to the COVID. Well, let me stay on the code. Let me do this real quick because I want to make sure hold on. Here we go. But yeah, something is. I mean, I have. This is gonna be interesting. It's an interesting time. It's an interesting time to be in. I mean, our generation has never experienced anything to this magnitude. Hold on. This Spanish flu thing has made me think that we're moving kind of like the same as them. As this right here, Spanish flu. Because if you know anything again about Spanish flu, also it was right around the time dealing with the depression, about World War One. It was a lot going on, kind of like now. But I'm gonna go back to this one. I'm not done yet talking about COVID, and then I'm gonna talk about the layoffs. I don't want to get too ahead of myself. Hold on. Let me see. Here we go. One more thing, talking about wave 2 in comparison to let's see. Which one is that one? Hold on. Let me make sure. Okay. This one says could be. Okay, got it. Here we go. Okay, so oh.
A second wave of the
You've likely been hearing a lot about a second wave.
A second wave of the coronavirus outbreak in the fall.
It's a second wave of COVID-19.
Will it be a second wave?
We are going to see a new wave.
Countries, including Canada, are starting to open up their economies. By lifting restrictions, there's a risk that coronavirus cases can spike. So we look to history for answers. In this case, it's the Spanish flu, the largest pandemic in modern history.
The 1918 influenza pandemic had 3 distinct waves of infection, with the second being extremely deadly. The first wave happened in the spring of 1918, with the second wave coming in the fall. As you can see, the second wave was responsible for most of the deaths. Then came the third wave, which happened in the spring of the following year. It is estimated that a total of 15 million people died worldwide from the Spanish flu. The pandemic ended in the winter of 1920.
Although looking to the past may give us some hints on how the coronavirus pandemic may unfold, experts I spoke to say these comparisons should come with a grain of salt, since so much has changed since then.
When the world was hit with the Spanish flu, the First World War was coming to an end. The second wave of infections came when troops were going back home. On top of that, healthcare systems were not as developed as today, modes of communication differed, and physical distancing practices weren't as stringent. So the circumstances around the COVID-19 outbreak aren't the same, but we still face a set of challenges that could lead to a second wave. First, we know that a vaccine is not available yet. Restrictions are being lifted, and immunity is still not clear. Knowing this, we have to understand as a population that new outbreaks are probable when physical distancing measures aren't followed.
But we know that the population in Canada is still mostly susceptible to this virus, so that there is continuously still the chance that it could reignite into clusters that then become outbreaks.
Another important part of the calculation, mass testing and contact tracing. By having these measures in place, it can significantly reduce the chance of a second wave.
It's really important to remember this is an asymptomatic pandemic. People can feel absolutely fine and be very contagious at the same time. So that's why it's even more important to do sensible testing.
In South Korea, for example, which has been praised for its rapid testing and containing of the virus, recently saw a cluster of new outbreaks in its capital, sparking fear of a second wave. It called for renewed tracking and aggressive testing measures shortly after the country eased up on restrictions. One thing to note though, it's not a realistic option to test absolutely everyone, since there are only so many testing kits and resources available. So Fernez says it would be best to find a happy middle by testing the most at-risk populations. By doing that, and being on top of new cases, public health can better trace who was exposed. That's where contact tracing comes in.
you try and answer two questions. Where did they get it from? Who is out there spreading it that created this case? And given that we have this new case, what contacts has this person had with other people who might then get sick?
The goal of this is to quickly identify who's been exposed so they can go into self-isolation. By self-isolating, we then stop the spread and reduce the risk of a second wave. So while Canada and countries around the world are starting to lift restrictions, mass testing and contact tracing will be key, at least until a vaccine is available. Thanks for watching. To stay up to date on the latest breaking national and international news, be sure to subscribe to our channel, where we also dig into big.
So, as you can see, in this pandemic, the Spanish flu, it was wave 2. That was the biggest impact. I think people are so eager, like I said, because it's financially draining, emotionally draining, and mentally draining to be in lockdown. People want it out, and they want it out by any means necessary. And they got out. If you remember Florida, their beach was packed. I was like, wow, as soon as they said y'all can get out and go to Florida, everybody left and went to Florida. And I had some friends that went to Florida during June when they first opened up the beaches. And I actually used to work with these people. They don't live in the same city as me, but when I lived there, that's where they in Arkansas. She sent messages saying that her and her husband, because they went to Florida, have COVID. My aunt said she had COVID. We was like, what? But she didn't tell anybody. She got better and moved on. Some of us have even gone as far as saying we think we had COVID and didn't know it. That you hear stories of people saying that back in November they had the flu, or back in November or December they had the flu and they thought it was the flu, but they went and got a flu test and it turned out negative, but they had flu symptoms. And everybody was like, back in November, I was sick in November. I was sick to the point I was like, I got to go to the hospital, and did a flu test. I was fine, found I had pneumonia, and that a lot of people thought they had it. And it was just because of they didn't quite know what COVID was. So I think a lot of people came across it. And the crazy thing is, when I got sick, and I'm not saying I had COVID, I never got tested at the time. They didn't have testing for it. They didn't know what it was. But back in, I want to say November, what was interesting is it was during the time I was still a part of Berean. And I was doing a live with Berean. And it was like right around the time I left. I was getting ready to leave anyway. But it was like November 11th, to be exact. I was on a live. And as I was going, when I was in the live, I turned my screen off. And I was talking because I got sick just like fast. It was like I was sitting there that day. I was like, I have a little, headache. And I just didn't feel good, but I just thought it was, I thought it was just, I wasn't feeling good. I didn't think anything about it, and I was going to shake it off. It was around 2:00 when I first felt that. By 10:00, I thought I had gotten hit by a Mack truck. That's how bad I felt. And it came on me so fast. And it attacked my breathing. I remember that. And I had a horrible fever. I was sweating. The interesting thing is my daughter was around me at that time. And my daughter was, in and out of my room and, coming to talk to me. I still taking her to school. She was fine. She good. I guess because you're young, but I thought it was horrible. But it wasn't as bad as them because I could breathe. They gave me some steroids and I went home and what is it? Z-Pack. Once I took that Z-Pack, I was done. I was good. But it took a minute for me to come back. My aunt says she had it. My sister says she thinks she had it. A lot of people in that time before COVID was COVID thought they had it. A lot of people went to the doctor. The doctor was like, you don't have the flu. My sister said, doctor said she had flu. My aunt said same thing. The whole time we sitting here did not know what was going on. When COVID hit, a lot of people, even Pastor Kelly talked about it. Some people he knew in his congregation was like, maybe we had COVID and didn't know it. Because if you remember at that time, that's when COVID started becoming the news. But still, a lot of us wasn't adding it up that we probably had it. So, yeah, it is something that, to see and to understand. And I noticed Keisha Israel said she had it. It's interesting. But the thing is, what they're finding out is the death, even right now, the problem is the ventilators. The ventilators is what's causing some of the problem, because they say even in Africa, they don't do the ventilators. But I think it's a bad flu that if anybody who has any underlying issues, it won't help them. I heard elderberry syrup, and I was going to order me some elderberry syrup online. I know Ron Shields has an elderberry connect, Divine Prospect. So go to his page, and I think it's in one of his last live he did. He has a link to where you can order some elderberry. So I'm gonna probably order it from where he said order it from. I'm gonna go out there, but it's rough out here. It's bad. But my aunt was the only one that was diagnosed to say she had COVID, and she had it back in January. So it's something to think about. Now with the COVID, hold on. Hold on. I lost my video. Hold on. Okay. All right. Okay. So I'm gonna show y'all. But one thing with this COVID is layoffs. Because we're in the middle of a pandemic, people are unable to travel. Work environments have changed drastically. So guess what? In fact, what's so crazy is at that time I was getting ready to take a job that I would have to travel like 80% of the time. Companies, these hotel industries, I used to work for one, depend upon those people. They pretty much, during the off seasons, it's about travel. It's about corporate travel, corporate, with the hotel industry. It's about, just because when I used to work there, we would always worry about, supporting, making sure everything was up and running for corporate travelers or people that travel for their companies from Monday until like Thursday, because we knew Friday they was checking out. So when we used to work for us, the corporate as a whole, Hilton, we would always, I actually worked for the help desk at one time when I was just graduating from college and I needed a job. And that the department I worked for, we supported like the Wi-Fi or network. So if it went down, we would have to, fix it or whatnot and walk them through it. And it was a help desk. But between Monday and Thursday was the hours that, we watched, because this is how they made their money, through corporate travel. Well, when I later on in my career I worked for Walmart, started working in project management, started doing stuff, I worked for Hilton again and worked in their app and website support team that used to implement, any upgrades to apps, anything dealing with the website. I actually worked on Digital Key. If you've ever done Hilton, I worked on that project. I did stuff like that. We were heavily dependent upon corporate, but the summer is when they make their money. They make a lot of their money. And nobody can travel right now. Corporations have shut down. Everybody's virtual. So the hotel industry has been hit hard. Nobody's paying attention to car rentals. People got to rent cars when they're doing this. Disney was planning to open up, I think, July 14th. They're not opening up. Schools are being impacted. I used to work for a company that did school uniforms, or did a uniform for cheer competitions. They shut down. They laid people off. I was like, wow, everything is impacted. You can never say, I say the only thing that's not impacted right now and probably still moving full throttle is hospital. That's the only job. But right now, so many companies have laid off employees that I don't even think that hospitals can handle the workload. But if if you're working for things like Zoom right now is heavily hiring because of the need to do virtual type of we're moving over to a virtual corporate environment. Amazon is hiring. You got to look and kind of figure out what's hiring. But like I said, there's been so many layoffs on one end of the spectrum that what's coming, they're not going to be able to handle it because there's still not enough jobs to manage the amount of layoffs. I'll show you the video dealing with Hilton. It shocked me, but it didn't shock me that they laid people off because we're in this time and season right now. So,
Hilton lays off 22% of its corporate staff. New York Hilton Hotels is laying off 2,100 employees, or roughly 22% of its corporate workforce, as the lingering effects of coronavirus continue to depress demand for leisure and corporate travel. The hotel chain is also extending the existing furloughs for many of its corporate staff for an additional 90 days. Hilton, HLT, announced the initial furloughs, as well as temporary pay cuts for executives, in late March. Never in Hilton's 101-year history has our industry faced a global crisis that brings travel to a virtual standstill, CEO Christopher Nassetta said in a press release, adding he was devastated by the decision. COVID-19 all but destroyed the global tourism industry, resulting in temporary hotel closures, border restrictions and flight reductions. Large hotel chains were some of the largest victims, including rivals Marriott, Mar, and Hyatt. Marriott, the world's largest hotel chain, also furloughed some employees in March. Last month, the company said the pandemic is having a more severe and sustained financial impact on Marriott's business than 9/11s and the 2008 financial crisis combined. Hyatt also announced last month it was axing 1,300 employees due to the historic drop in travel demand and the expected slow pace of recovery. U.S. hotels have lost more than $30 billion in revenue, and nearly 6 out of 10 hotel rooms are empty, according to the American Hotel and Lodging Association. Still, there's some signs of hope of a slow recovery. The leisure and hospitality industry added 2.5 million in jobs in May, a turnaround from the 7.7 million it lost in April. And the hospitality analytics company STR also noted an increase in hotel occupancy for the week ending June 6. Click.
So what the funny thing is, if you notice the end of it, it said it was an increase June 6th. The only reason they had a spike in hotels at that time is because they released it. They said everybody can go out and play. There's adults. Yeah, you can go outside and play now. And what happened was when they found out they can go out, it was a mass dash to whatever city you want to go to. Because I've been in the house with my family. I've been in the house with my children. I've been in the house working. I need a break. And the mindset of this place is I need a break. I don't care by any means necessary. I have to take a break. I got to go. Even when the world says stop for a minute, no, I got to go. And what happened was it was a mad dash to go out of town. Because actually I was looking at going out of town because I was, at the time I was thinking about, and I'm still thinking if I can transition and move somewhere else. But I was getting ready to go and do a road trip. Me and my daughter, we're going to go check out, cities, job I'm getting is remote. So I'm like, I can do, I have the flexibility to live anywhere. And that was the mindset I had. Something just was like, don't go nowhere. It was nothing but the Holy Spirit. Still out there looking on. Let me see what these hotels looking like. So I looked at Florida, one of our hangout spots. It's this beautiful beach that I've gone to and my daughter's gone to with me in Florida. Hotels booked. Can't find a hotel room. Was trying to find flights. And I really wasn't thinking about, I was thinking about flying, but I was a little concerned. Couldn't find, flights were booked up. Everybody had made a mad dash. And the first thing came to mind was the amount of people that are in these tourist towns. It is a breeding ground for a wave too. So I said, let me sit back. I'm going to chill. I'm not going to go anywhere. So I'm going to give them until mid-July. And if everything looks good by mid-July, mid-July, I'm going. So as I sit and watch, I'm hearing about the spikes, constant spikes. But if you listen, a lot of the spikes are in vacation areas. People leaving, coming from Florida, people leaving, coming from, because let me see, I want to see where spikes. Hold on. By state. Some of these states are vacation spots. So hold on. I'm gonna get past this little commercial. Yeah, Pastor Johnson, you are correct. Let me see. So he says job in restaurants, hotels, and retail are reportedly affected the most. That is correct. Let me see. I don't ever believe in job reports because they add jobs. Doesn't mean that people are hired. You are correct. So let me see. Come on, let's get past this ad. Okay. This was a report on CBS News on June 25th. So let's see.
More than 38,000 across the country. In some places, it's worse right now than it's ever been. The three most populous states, that's California, Texas, and Florida, all broke their own records for the most cases reported in a single day. Think about that for a second. And the CDC predicts nearly 30,000 more Americans could die by mid-July. And while Bojorquez is in Homestead, Florida, Manny, how is Florida handling this spike? It's not good.
It is not good, Gail. Good morning. Several state and local jurisdictions are pushing ahead with mandatory mask orders and enforcement of social distancing rules. Hospital capacity is also a concern. Homestead Hospital behind me reached capacity on Tuesday. Officials say some beds have now opened up again, but hospitals across the area are prepared to add additional units if necessary.
I think we had COVID on the ropes. We were doing very well, and it's making a comeback.
Dr. Sergio Segarra is the chief medical officer of Miami's Baptist Hospital. He says he's seen a significant increase of coronavirus patients in the last few days, mostly walk-in cases.
These are community-acquired COVID infections as opposed to nursing homes.
Florida was one of 5 states reporting record-high increases in coronavirus cases on Wednesday. Another was California, where more than 7,000 people tested positive. Rises in hospitalizations and rates of infection prompted Governor Gavin Newsom to warn that a rollback of the state's reopening is not out of the question. As cases rise in the South and West, the one-time epicenter of the outbreak is taking precautions.
People coming in from states that have a high infection rate must quarantine for 14 days.
The governors of New York, Connecticut, and New Jersey warned those in violation of the rule would face a fine of up to $10,000.
Wow.
Their list of states includes Texas.
There is a massive outbreak of COVID-19 across the state of Texas.
Governor Greg Abbott said certain parts of his state could face new restrictions after seeing more than 10,000 new cases in 2 days.
The situations in the hospitals continues to worsen.
In Houston, hospitals are at 97% capacity, and statewide hospitalizations rose 57% in the last week. Several states, including Texas, are reporting large increases in cases among young people as bars and restaurants reopen.
I understood the chance I was taking going out, and obviously now I'm paying that price.
21-year-old Adriana Carter says she and her friends caught the virus after a night out in San Marcos, Texas. She says while she was being careful, many others were not.
We're trying to figure out a new normal, and I hadn't gone out since the bars reopened. It just so happened that the one night out I did contract coronavirus.
And another reminder that the young are still very much at risk from this disease. 17-year-old Carson Davis, a high school student in Fort Myers, Florida, was airlifted to a hospital Monday and passed away the very next day from complications of COVID-19. Anthony?
Well, Borges, Manny, thank you.
Wow. It is something. And you notice it's the young people. Their parents don't know how to tell them, go somewhere and sit down. So I say honor your parents. They got to get out. They got to, and do things that they want to do. But another thing that's coming through that I kind of caught, and Lisa Cabrera talked about it today, but I have been reading on it, evictions. Think about all these extensions that they've given people. These landlords have given people on their rent because of COVID. It is now beginning to come back and bite them. And they're talking about the high level of evictions in across the across the US because of the extensions. Landlord. Hold on, I'm trying to find the one I saw this week. So let me see. Hold on, I'm trying to find the one. Oh yeah, here it is. Hold on. Here we go. First, Atlanta, Virginia's been feeling it. Here it is. Hold on. Let me get past the commercial. Virginia has given the green light on evictions. I think the hot thing they talking about now is Texas as well. Hold on. Share. So all these people with these eviction holes, freezes, a lot of them said we'll lift them in June. Some say we're lifting it in July. We're here now. And guess what? We're getting ready to go through a wave 2. So if some of these people are already evicted, we're going to also have to deal with homelessness. Because some people are going to get kicked out. And these landlords care nothing about a pandemic. They care about their money. And by the time I think the states will be able to catch the evictions, people will already be evicted. Because landlords are trying to move as fast as they can because they know wave 2 is coming. Let's hurry up and get them out so that we can get an available space and before they put another freeze out there. That's how they're thinking. But what they don't realize, because of greed, that once they do put these people out, guess what? Nobody's going to really be moving. Because guess what? We're going to be on. We know we're going to have to stay, where we are, or until we get past the wave. Some people are smart enough to say, I'm going to go ahead and live with my parents or live somewhere else because I don't want to, I want to have somewhere to, stay. People are not going to rush to go rent these apartments or these houses. So because of their greed, nobody's going to take it, but they're not looking at the big picture. They're looking at right now, I need that money. So hold on.
The news story at 5, a housing crisis within a health crisis. That's predicted for the next few days as the Virginia Supreme Court has lifted the ban on evictions, effective July 1st. The COVID-19 crisis put the brakes on most evictions, but now evictions are green-lighted under an order issued by the Virginia Supreme Court. Advocates for the poor predict disaster for the region's most vulnerable. Legal Aid Society of Eastern Virginia is bracing for Monday morning. Newport News General District Court already has a full docket.
Bringing 42 at 8:30 in the morning.
Wow.
And then 39 on the 2 o'clock docket. These are all evictions.
You're concerned men, women, children could end up homeless behind what is happening beginning Monday.
There really isn't. a safety net now. There aren't even shelters really open right now.
Some guardrails are in place to protect those whose rent or mortgage is federally subsidized. Meanwhile, property managers say they have a job to do.
Anybody who has actually come and made payment arrangements with my office, we have no problem working with you. But the people that have not given us dates as to when they think they can pay, or not even returning a phone call, those are the people that you're like, well, fine, you're the first one in line to go.
Legal Aid Society of Eastern Virginia will be in court to help. They say call ahead to see if you qualify and show up for court.
The case is going forward. If you're not there, you can be evicted.
A. Williams of Portsmouth is current on her rent, but is concerned for others who could end up on the streets.
We have to be on survival mode, so I don't feel like it's right for them to just evict people. I think you should give them a little time or more assistance.
Earlier, the governor gave residents more time, but unless there is an emergency order, time's up on the 29th.
Yep, that's it right there. They don't care anything else about the people and what's going on. Here's the one right here.
Dowdell,
Texas is the one right now. These folks don't go to war because they getting ready to get kicked out. Let me see. Yep, it's not funny at all, but wow, hold on.
At a call center until March when her father fell gravely ill.
I had to go to New York because my father wasn't expected to make it.
He had the coronavirus?
He did have the coronavirus. He caught that in a hospital, and he fought that, God willing.
Dowdell returned to Texas with a fever and self-quarantined for 2 weeks. She lost her job and fell behind on her rent. Her landlord, Isa Fazlalizadeh, gave her little leeway. He filed eviction against you right in the middle of the pandemic.
Yes. I didn't know because he didn't tell me that he filed. He kept saying, if you move out, then there won't be any problems.
But this is the moment when Dowdell was confronted by her landlord in the driveway of her Houston home.
Unbelievable. So he's blocking the driveway so I can't leave.
Dan Lieberman joins me now. And Dan, I think we all want to know, how did that confrontation with her landlord end?
Hey, Allison. Yeah, he confronted her right there in the driveway, and she was scared. Her kids were scared, and ultimately she decided to move out a few weeks ago. She was facing an eviction. He filed an eviction case against her in the Harris County court system there in the Houston area, and rather than go to court, rather than possibly get a terrible mark on her credit and damage her future rental prospects, she decided to just pack up and move. It was a terrifying moment that her son did capture on video. She's staying with a friend right now. She had to pack everything up into a U-Haul in a moving van and move to a friend's place. She says that they feel homeless right now. They're looking for another house to live in. She's looking for a job still. She lost her job during the pandemic. It's been hard for her to actually get another place because many properties she's applying for are still asking for proof that she makes 3 times the rent. And during a pandemic, while she's on unemployment, that's just not possible. And it's not possible for many folks out there, Allison.
Oh, Dan, what a horrible thing to be going through at a time like this. I know you've been looking into evictions in the Houston area since March when both local and federal protections took effect. What have you found?
Well, we saw in the Houston area alone that since the federal moratorium began in March, there's been more than 3,200 eviction cases that have been filed in the Harris County court system. That's the Houston area. That's a really high number. And what a lot of people don't realize is even though there's a federal moratorium that is in place through the CARES Act, that is really not covering a lot of renters. There's a lot of properties that are not covered by that. It only covers properties properties that have federally backed mortgages. And many landlords we found in our reporting in the Texas area are simply not following the rules. Many don't even know about the rules. And so it really creates this patchwork of problems for tenants and landlords as they try to figure out what the rules are. And now we're seeing nationwide that nearly half of the state moratoriums have expired. So you just have millions of people who are not covered, and we're seeing protests that are starting up here in New York and Brooklyn today as moratoriums end. So this is a nationwide problem, and until there's more funding, people like Erica in the Houston area can try to get local assistance from the city, from different organizations, but it's really just a patchwork. The money is gone in an hour and a half. There's not enough of it. And so there needs to be a much more robust federal response to help people in this crisis.
Yeah, Dan, let me ask you a little bit more about that. Is there specific help out there for people who are worried they can't make their rent? It sounds like from what you're saying, it's not a very organized or depth there of resources for people to go to seek help from.
Yeah, I mean, it's a real problem. And look, this is hard on landlords as well who have to pay their mortgages. And so, and what we heard from landlords associations was that it's in their interest to keep tenants, if they can, in place and to come up with arrangements with them, try to get on a payment plan. But in many cases, it's not possible. And until there is a more robust federal response, until there's more legislation passed, there is a bill, the HEROES Act, that's in Congress right now. It's stalled in the Senate. It's on Mitch McConnell's desk, and it is not passing. And $100 billion of rental relief assistance is just waiting to pass in Congress. That would go a long way, but really, it's going to take a lot of good politics, people coming together at the state and local level to really also provide more assistance for people, because we're now seeing a crisis where there can just be a wave of evictions in the coming weeks and months. Allison.
All right, Dan Lieberman, thank you so much.
You got it.
And you can watch more of Dan's.
Yeah, I'm telling y'all, this is a real deal. And what people don't realize too with this and the landlords, and they said something and it made me think about it. The landlords, if they don't have renters, guess what? If they still have mortgages on their houses, they can't pay their mortgage. They can't keep their bills going. So if they lose their house, ultimately, the renters will get kicked out. So it's going to be a snowball effect, and we're going to see it. We're going to see it, and it's going to be bad. But also thinking about, and I'm going back to the spike. People are so needing normalcy, they don't know what to do. By any means necessary, we're going to get out here and don't care about getting nobody sick. It's about me being able to go out of town, and now I'm sick and I've gotten others sick. But the other part people is missing. The economy is crashing. The stock market is up, down, red, green, red, green, red, green. Because if it's red and you see the dip, that means they lost. If you see the green and it goes up, it means they have gains. It's been so unstable, you don't know how much, that's lost. So let me see. Because I've been watching the news. I've been kind of like, I'm gonna talk about this when I get a chance, or when I have a live, I'm gonna talk about it. Because the thing is, I've been telling people, if you have the means to pay your bills, by all means, pay the things that you need to pay. Anything that deals with your rent, car note, even utility bill. Because if you're not paying your utility bill, game over. trying to find this other article. But if you're not paying your utility bill, guess what? Game over. Don't hold the money when you have it. Hold some of it because you don't want to use all your assets. Hold some of it. But try to get those things out of the way because they're not going to forgive what you owe them. You're still going to have to pay them. You're going to have to either pay them on the front end or the back end. And I would rather use that type of system when things are really bad, where I just know I ain't got nowhere to go. I don't have no way to fix it. And I'm at my wit's end. So with that being said, that's when you kind of say, okay, I can't pay, but everybody was coasting that little $1,200 they gave us. Or I got 17, but when you get that money, put that money aside. Crazy thing is we're in the middle of COVID and I have heard more fireworks family this week than I've ever heard. I'm like, where are they getting this firework money from? And whoever giving them the money for the fireworks, I'm ready to go holler at them and say, quit buying fireworks for your children because they disturbing me and my dogs. But the question is, where are they getting this money? Are y'all using y'all COVID money for foolishness? But they don't like people to ask them questions like that. Have a nest egg, have a stockpile of food. There's nothing wrong have food sitting aside because you never know what's gonna happen. This food shortage, people didn't forget about. People didn't forget about this food. This hair is in my face, but this food storage, people have forgotten about. Everybody's so focused on, normalcy. Where's that video talking about? They're so wanting it to be normal, but they're not thinking about at what cost. This was posted 2 weeks ago, talking about, the economy and recession.
And for gender discrimination in the workplace or at school, would you? So why at home? Stand up against gender bias and stereotypes in your home by treating your sons and your daughters equally. The more you see her, the more you know.
Sponsored by Secret Deodorant.
Here we go. This is one more thing. Hold on. I ain't gonna keep y'all still up. Y'all hanging with me? Hold on. Here we go.
To declare so quickly that this was a recession. I know in 2007 it took almost a full year. What made it such a clear call?
Well, first, I don't think we surprised too many people by saying that the U.S. economy had declined after sometime early this year. But what was very striking about this downturn is, of course, its speed and its depth, and that made the
Yeah, and that's just the way it's done. But if I could, I want to ask Jim a couple quick questions here. Jim, we love having you back, but
Y'all can't hear it? See, you know what? I'm so over them. Okay, let me see.
Let's say we don't
Can
want
y'all
to
hear
have
it
you
now?
back, and we don't want to wait for the NBER to declare the end of the recession. How will we know that it's over? What will you guys be looking at? That's one. And two, discuss this curious line.
Happily surprised that you guys were to declare so quickly that this was a recession. I know in 07 it took almost a full year. What made it such a clear call?
Well, first, I don't think we surprised too many people by saying that the U.S. economy had declined after sometime early this year. But what was very striking about this downturn is, of course, its speed and its depth, and that made the analysis substantially easier in terms of the data that we see. What we observe is that there was a dramatic drop off, as we all know, in economic activity during the second half of March, resulting in dramatic increases in unemployment, dramatic declines in production, and for reasons that in some sense are not the usual sources of business cycle fluctuations, essentially government edicts which were closing down many sectors of the economy. Situations like that make it a little bit easier to identify where the turning point might be than in a more normal situation.
Can you explain why February? We understand that the expansion has to kind of peak in the month and then the contraction begins. And I know you put a lot of weight in particular on employment and production, but jobless claims were still fine in February. The U.S. added jobs. Why not have the recession beginning in March?
I think I'm very glad you asked, because it's the answer is in some sense about the convention the NBER uses when it defines the first month of a recession. The key starting point is the peak of economic activity was in February, right? And March was therefore lower than February. When we say that March is the first month of the downturn, that means that in some sense, month zero, the month in which the recession began, is constructed as February in that. But I think it's easier to think in terms of when the peak was, and the monthly peak was very clearly in February.
Interesting. Month zero, Steve. It reminds me of trying to figure out what year. Month zero is the start of this recession.
Yeah, and that's just the way it's done. But if I could, I want to ask Jim a couple quick questions here. Jim, we love having you back, but let's say we don't want to have you back, and we don't want to wait for the NBER to declare the end of the recession. How will we know that it's over? What will you guys be looking at? That's one. And two, discuss this curious line in the towards the end of your release here, where it says it warrants the designation of a recession, quote, even if it turns out to be briefer than earlier contractions. There's a sense there that you guys have this feeling that maybe this is going to be over pretty quickly.
Yeah, I'm going to start with the second, Steve, and want to emphasize that the committee has no crystal ball, right? So we don't have a view of how long the recession might last. But you are right that the committee acted more quickly this time than it typically does. And as the committee was contemplating whether or not it could determine that the peak had been passed and that we peaked in February, one question was, well, given the definition of a recession, which is usually a decline in economic activity spread across the economy for a period of several months, did we know yet whether it would be for several months? And we were confident that we could see, in the existing data, that there was a sharp decline in March and in April. We were not sure, of course, yet what was going to happen after that. And the committee was in some sense with that remark was trying to speak to even if the trough turns out to be 2 months after the peak, the depth of this downturn is such that the committee felt comfortable labeling that as a recession.
Yeah, I agree. I'm feeling Eric. I agree. We do need to be paying attention to the political party, but you don't realize. I realize that the political party is tied to the money system. If I don't know anything about the money system, I'm not going to understand what's about to happen. So I'm going to pay attention to the money system as well. You're going to have to be kind of like look at both sides. But it is a lot going on. It's a lot going on. Is wave 2 coming? Wave 1 has not left yet. So talking about wave 2 is like, okay, so is it yeah, wave one has never left. And what I think is finna spike, and it's spiking now as we speak. Uh, excuse me. It's a lot of it's a lot of indicators. I was talking to Yacoba and Tayu and Dante a couple of days ago, and I was like, y'all, it looks like the woes of the Bible to me. You got woe one, and then woe two is supposed to be horrible. Um, we're going to see unemployment rate increase. See, with these eviction, homelessness. I saw a report of the amount of people starving now. Hold on. I'm gonna go to this one. Okay. Let me see, because I saw something about that. The amount of people that are starving due to this. Hold on. When did I show this? This one is old. Okay. Okay. Here we go. And these are just some of the things that I have ran across, and I'm like, wow, this is where we are right now. Never thought this was gonna happen. Well, like this.
Cars pull up to North Glen High School in Colorado, and parents are handed 2 lunches and 2 breakfasts. More than 10,000 meals are distributed here each pickup day.
We've never experienced this kind of volume outside of the school setting.
Pat Hamilton is COO of the Adams 12 5-star school district, which switched from free and reduced price lunches to remote feeding almost overnight back in March, when the pandemic forced schools to shut down. Demand has been brisk for these meals, which are available to anyone.
Certainly there's a need here, and we're glad that we can be providers for our community.
They put some meals in there that you can make without meat and things like that have meat substitutes already in them. So, you really could survive on just that if you had to. And I think that's amazing. Hi, Donna.
Food recovery organization We Don't Waste provides some of the ingredients for these federally assisted meals. Foundation, started by the father of a school shooting victim, supplied a protocol it developed to reunite students and parents after a school crisis.
If you think about it, food distribution is kind of like reunifying a lunch with the students. In America today, there should be no reason for anyone to be hungry.
And yet, too many are.
We run a statewide food resource hotline, and once this pandemic started, our call volume tripled. So we know that need has really spiked.
Compounding things during this time of layoffs and economic uncertainty, many students' access to school lunches was cut off when their schools closed. In March, Washington approved the Pandemic Electronic Benefits Transfer Program to reimburse families for 3 months of missed meals, totaling $279 for each child.
Even though $279 may not sound like a large amount, if there are 2 or 3 children in the household, it will be a significant boost to be able to help them provide some additional meals.
Unfortunately, at least in Colorado, the system to handle payouts is not yet up and running, but the state promises money will start flowing soon.
We know that this benefit cannot get out fast enough for the families who could use it.
During these unprecedented times, folks who are hurting need help, says John Michael Keyes.
We do live in an incredibly fortunate and wealthy country, and we should be able to do some of this stuff.
This food distribution is expected to continue all summer.
It's been a labor of love. The thank you letters that we get from our kids, the signs that we see, it makes it all worth it.
Hendrik Sabrandi, CGTN, Denver.
This is going to be an interesting time. A very interesting time. It's going to be, I don't think the Rona is that much of a distraction. And you think about it in the Bible, there are going to be plagues. There are going to be plagues. There are going to be widespread spread plagues, and it speaks of it. Corona isn't just a distraction. It's a reality for some people. Oh, I just got the message. It's got sound now. But yeah, it's something that we need to be aware of. We don't need to ignore it. I've seen the ramifications of it. I think a couple of people. You got Keisha in here, Eric, that has had corona or had COVID. I had family members that had COVID. Is it something that we need to ignore? No. Is it something we need to be able to have the ability to multitask and watch more than one thing transpire? Yes, we don't need to get off of corona and then start talking about the protest, go from protest, talk about starvation. We got to pay attention to the entire, when you play chess, you don't look at just that piece, you look at the entire board. And that's how you have to do it. So that's how, is that right, Jacoba? Because I know you play chess. I think you have to look at the entire board. But ultimately, the end result will be, I think, a dead economy. A dead economy. The economy is going to be impacted greatly because there's too many things that's going on all at one time that they can't manage. Like I said, you have the disease, you have unemployment, you have starvation, you have homelessness because they're getting there now and they're already there. You have then, not to mention, you got what's going on with the police officers, defunding the police, which on one end, I'm like, yeah, we need to train the police to act like police, not defund them. But ultimately, we're going to see the whole society is falling apart as we speak. Then, not to mention, Black Lives Matter, and I'm not a Black Lives person because I know the funding is not true to what it means. I like to say what as I says, he says Israelite lives matter. As our fingers said that, and when he said it, it's like, yeah, right, because when we fall up under the window of Black Lives Matter, we're putting, it's not funded where we want. George Soros and all those individuals are funding, and actually, it's being driven by the gay community. So we see a lot going on right now, family, and that's my whole goal when I do these type of shows, is allow you all to see everything collectively. And I know everybody's keeping up with news, but certain news they'll tell us, certain news they won't tell us. Colleges now. What people don't realize is colleges now are having to regroup. So if your kids go to college, guess what? They probably don't have to be at home and work. It's going to be virtual classes. Jobs are virtual. You got a lot of things that are going to change right now. So just, continue praying and ask the Most God to cover you and protect you and make sure you're prepared for what's to come, because famine is coming. Famine is here. Pestilence is here. People don't love one another and they don't walk in love, as it states in the Bible in Revelation, that the love will not be manifested on the earth. And I was going to speak on that, but I'll talk about that on another day next week, to talk about how to love your neighbor, what it means to love your neighbor and to walk in love, and what that means as far as a biblical stance, because these are trying times. And I think how you live is going to predict how you're going to make it through this. So just also a new thing that my daughter told me about, and I want everybody to kind of watch their kids. My daughter caught it and she told me about it. On Instagram, our kids are on Instagram. They're on what's the other social media page? It's Instagram, and it's TikTok. Witchcraft is real. It's a lot of communities within the voodoo community and hoodoo community that are creating pages and memes and TikTok pages talking about practicing hoodoo, practicing voodoo, and the kids, my daughter's generation, is seeing that part right there. They're trying to push our children into, witchcraft. And my daughter was like, I just cannot understand how people turn away from God and go to an idol God. I said, everybody wasn't raised like you. So kids are now playing with witchcraft because they have nothing to do. And when you look at these pages, and when she showed me one of the TikToks where the person was talking about ancestors, our ancestors, be careful with that, and teach your children and let them know, don't rock with that, and explain to them why. Because I told her about it, she's prepared. So that's another thing, idle minds. Our kids are sitting here, idle minds at Devil Workshop. She's sitting here. She doesn't have anything to do. I monitor what she does. I talk to her, help her find things to do. And I will say, you all do the same thing for your children, because they know that these kids are doing nothing but sitting idly on their phones or iPads or, computers, just going through TikTok, going through Instagram, and they're running across, things dealing with ancestral worship. And if you're not watching them, you don't know what they're doing. And again, these kids are feeling it and they looking for any way out. You have a TikTok where someone's saying, I can teach you how, you can do this to cover your family during the pandemic. And they're scared. When my daughter showed it to me, I was like, wow. So just watch. It's a multitude of things going on. Let me see what these comments are saying. So, Black Lives Matter and the mask people is a huge overlap. Okay. Yeah. But it's a lot going on, family. I was just looking at the comment section, but I don't want to keep everybody up late. I just wanted to kind of say hello, kind of talk to everybody, let them know what I've been running across as far as the news, keep them updated. I got other things in the news that I'm looking at now. I'm trying to keep my pulse on, which is, like I said, evictions, unemployment, different things like that. So I'll be talking about that throughout this week. I'm so glad everybody got on here with me. As you can see, Sista is starting to get sleepy. I thank y'all for your time. Family, I say stay prayed up. Ensure that you're praying for your families. Hey, y'all, stop deleting John's comments. Who's deleting John's comments? Stop it. And I can't see it. Well, if they would have deleted it, I would have saw who deleted it. I think it's John deleting his own comments. Okay, yeah, he said he's deleted. John, stop deleting your comments. You're fine. Keep going. But like I said, oh yeah, Israel, please buy firearms to protect yourself physically. We are being targeted. Yeah. Just be wise. Have wisdom. That's the most I can say. Have wisdom in what you do and what you buy. If you get a gun, make sure you're wise enough and your temperament can handle a gun. Because if you're quick to fall after handling, you don't have a gun, you don't need a gun. So ensure that you're wise if you buy a firearm. Don't just be buying them and then somebody say something to you. Because you see a different level of aggressiveness now. I'll tell you a quick story of what happened to me, and then I go ahead and end so everybody can go to bed so they can go to work tomorrow. But it's a lot of road rage. People are mad, and thank you so much, My Life Totally, for the super chat. I was driving down the interstate, and it's a lot of road work going on in my city right now, because we have the most raggedy, we have the worst roads, I think, in the South. Atlanta might have us beat, but it's a slim chance they beating us. But I pulled into this lane, and this black guy and his girlfriend and whatnot, they had, first let me explain, they had a drive out tag and the bumper was hanging in the front of it. That was the first thing I noticed about the car. I said, wow. I said, they tearing up their cars early. They're getting these COVID checks and buying cars and don't know how to drive. So I'm trying to drive, and I turn my brake on and swoop in front of him. I guess he was in a bad mood. He pulled around and got in front of me and slowed all the way down. So I got in the next lane to pass him. He got over in that lane. He got in the other lane. So we playing this game, and I had to stop. I said, wait a minute. Let me let him act a fool by himself, because the Holy Spirit checked me. And for me to control my temper and don't lose it. Because by this time, I was pissed. I was like, dude, I got car insurance. You don't. Your bumper already hanging off, and you got drive out tag. I have car insurance. I can tear your car up and go get mine fixed and have it in a week. I got a good car insurance. But I said, control your temper. And the first thing ran through my head was, people with temperaments that tend to make them react in a way don't need a firearm. Well, I was driving. The guy stopped in the middle of the road and just started throwing up finger signs and just being, ugly. And I'm sitting here and I'm watching him, and I said, nobody has done anything to him. I didn't even really pass him. But he was just angry because I got in front of him. And you just saw the spirit that he had on him. And he was just so angry. And he was mad like somebody had spit in his face. That's how mad he was. And like I said, he sat in the middle of the street, and I stopped. And somebody else was trying to get over. He moved over there. And it was like he was trying to distract everybody. He was mad at everybody for what we don't know. I'm still looking at the fact, dude, you got drive out tag, your front bumper hanging. What happened between you buying the car and now where your bumper is hanging? Like I said, COVID checks and new cars, and people don't know how to drive. End of discussion. So I finally passed him. And first thing ran through my head was I said, these people have literally mentally become, it's almost like demonic now. And you can see people losing their temperaments now and going off and ready to fight. We had a couple of drive-bys here. But right now, people are angry, people are frustrated, people don't have the necessary means to take care of themselves. They don't have the support of their family. And some of them just crazy, period. But with that being said, I'm looking at the chat. With that being said, let's just be careful. Let's make sure that we use wisdom in our day-to-day life, because right now the enemy is looking for anybody he can take out. Anybody that can be a threat to him, take it out. So just think about it. If I would have lost my temper, pulled over to the side, and acted a fool like he was acting, somebody would have been hurt. Sister E would have been on the news. And rest assured, Sister E wouldn't have been hurt. I'm not playing games like that. But we got to be careful, because the enemy wants to snuff us out fast. Like I said, control your temperaments. Don't let people send you to that place. Just stay prayed up. And that's it. Stay prayed up. So, like I said, family, I'll be back on hopefully tomorrow, possibly tomorrow. And I'll probably talk about a few other things as it relates to, it is a lot of mental illness, Peggy, right now. I'll probably be on tomorrow, and I'll talk about a few other things dealing with Black Lives Matter and a lot of other stuff. And I still want to kind of talk about law versus grace. I'm just trying to figure out how and what I'm going to say. And it's not even law versus grace. It's just law and grace, and how it works and how the spirit works, all that. So, I'll talk through that this week, but, everybody have a blessed week. I pray that your week is wonderful. God blesses you. The Most High Yah blesses you with whatever the desires of your heart. and he keeps your family. And I will be back on hopefully tomorrow. So everybody have a good evening, or good morning rather, because it's already morning somewhat. And God bless you, and good night.